Welcome to another episode from the Veterinary Research Channel. Today, we're diving into a compelling discussion surrounding the treatment of benign ureteral obstruction in cats, a topic that has sparked some debate within the veterinary community. Our focus is a published article that explores medical management of this condition and a subsequent letter to the editor that raises important questions about the surgical standards of care. The original article, published in the Journal of Veterinary Internal Medicine, investigates the outcomes of cats with benign ureteral obstruction treated medically. This obstruction can arise from various causes, including urolithiasis, pyonephrosis, and stricture. The study suggests that medical management can be more successful than previously thought, offering a viable alternative for cat owners who may be hesitant to pursue surgical options. However, the authors of the letter to the editor take issue with statements made in the original manuscript regarding surgical treatment, particularly the assertion that placement of a subcutaneous ureteral bypass device, also known as SUB, is the standard of care for these patients. They argue that this statement is not adequately supported and could mislead readers. To understand this debate, it's important to define benign ureteral obstruction. The ureter is a narrow tube that carries urine from the kidney to the bladder. Obstruction of the ureter can lead to a buildup of urine in the kidney, a condition called pyonephrosis, which can damage the kidney over time. Benign ureteral obstruction means that the blockage is not due to cancer. Common causes in cats include ureteral stones, urolithiasis, infection, pyonephrosis, and scar tissue, stricture. Traditionally, surgical intervention has been a common approach to relieve this obstruction. One such surgical technique involves placing a SUB device, which creates an alternate route for urine to flow from the kidney to the bladder, bypassing the obstruction. The original article mentions the placement of a SUB device as the standard of care. To support this claim, the original authors reference studies reporting high hospital discharge rates, around 94%, and median survival times of approximately 821 to 827 days for cats undergoing SUB placement. However, these studies also acknowledge potential complications associated with SUB devices, such as device kinking, luminal mineralization, and chronic infection. The letter to the editor challenges this characterization of SUB placement as the gold standard. The authors of the letter argue that a closer look at the existing literature reveals a more nuanced picture. They cite a range of mortality rates before discharge, varying from 6% to 21%, which translates to discharge rates between 79% and 94%. This is still a good survival to discharge, but is lower than the 94% mentioned in the original article. They also point out that median survival times can range more widely, from 274 to 827 days. Furthermore, the letter highlights a number of commonly reported complications associated with SUB devices, including device kinking, luminal mineralization, non-infectious cystitis, and urinary tract infection. Postoperative bacteriuria. The presence of bacteria in the urine has been observed in up to 36% of cats after SUB placement. These complications can be clinically significant. Overall complication rates as high as 88% have been reported, but more commonly, they fall in the range of approximately 48% to 56%. The need for revision surgery to address these complications ranges from 8% to 27%. A recent multi-center report even documented instances of SUB devices migrating through the digestive tract, necessitating a second surgical procedure. The authors of the letter draw a parallel to human medicine, where ureteral bypass devices are typically reserved for patients with end-stage genitourinary cancer due to the morbidity and mortality associated with permanent urinary implants. They suggest that, similar to human medicine, utilizing natural tissues to address the obstruction in veterinary medicine can help avoid many of the complications associated with implants. The letter emphasizes the importance of appropriate training and the use of magnification during surgery to address the small size of the feline ureter. They observe that complications such as leakage and stricture are substantially reduced when magnification is employed. While acknowledging that mastering microsurgery requires a steeper learning curve than SUB placement, they assert that it is achievable with proper training, with courses readily available for both human and veterinary medical clinicians. The letter also scrutinizes the original article's references to studies reporting high complication, mortality, and recurrence rates associated with standard surgical techniques. They cite a recent publication on ureteral surgery, where intraoperative magnification was used, and the incidence of perioperative complications was only 3%. Survival to discharge was reported at 92%, and the median survival time was 1,519 days, significantly longer than that reported for SUB placement. The authors of the letter also addressed the reobstruction rates mentioned in the original article. While the original authors referenced studies reporting reobstruction rates of 22% to 40%, the letter clarifies that these figures can be misleading. They point out that reobstruction was not identified in one study, and in others, the incidence of ipsilateral reobstruction after ureterotomy was 20%. The need for revision surgery in the reference studies ranged from 10% to 13%. The letter concludes by highlighting two important considerations for cats receiving a SUB device. First, current recommendations include regular irrigation of the device at 1 week, 1 month, and then every 3 months after surgery. Second, the need for revision surgery ranges from 8% to 27%. While recognizing the importance of ongoing medical management for these patients due to their underlying renal disease, the authors emphasize that the long-term financial commitment associated with SUB device maintenance, in addition to the management of chronic kidney disease, can be substantial. Unfortunately, there is limited information available in the current literature regarding the full extent of this financial burden. Finally, the authors of the letter bring up the issue of pain associated with ureteral stones. They note that in human medicine, ureteral stones are known to cause considerable pain and discomfort. Given the high morbidity associated with long-term urinary implants, human urogenital surgery prioritizes stone removal and short-term use of urinary implants. While acknowledging that measuring pain in cats with ureteral stones presents a clinical challenge, they suggest that it should be taken into consideration when making treatment recommendations. In conclusion, the authors of the letter argue that while SUB devices can be a reasonable palliative option in some cases, the use of natural tissues and surgical techniques should always be prioritized. They contend that standard surgical options and SUB placement appear to have similar survival to discharge and reobstruction rates, but SUB devices are associated with a higher rate of infection and need for revision surgery. Therefore, they conclude that stating that SUB device placement is the standard of care for this patient population is not justified. This exchange highlights the ongoing evolution of veterinary medicine and the importance of critical evaluation of treatment modalities. While the original article suggests that medical management may be a more viable option than previously thought, the letter to the editor urges caution in considering SUB placement as the definitive standard of care. The authors emphasize the need for careful consideration of potential complications, the importance of surgical expertise, and the potential benefits of utilizing natural tissues whenever possible. This debate underscores the importance of staying informed, critically evaluating research, and considering all available options when making treatment decisions for our feline patients. It also highlights the value of ongoing research to refine our understanding of optimal treatment strategies and improve outcomes for cats with benign ureteral obstruction. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.